Florida TPO is committed to shaping our transportation future. We're focused on planning, funding, clean fuels, and new technologies for a vibrant, connected community. Learn more at northfloridatpo.com. Baptist Health is a proud supporter of First Coast Connect. Baptist Health, committed to building a healthier community for all of us. More info at 202-4YOU or baptistjacks.com. Local IQ, a digital marketing platform dedicated to offering services to help struggling businesses meet their goals. Services such as customized branded content solutions, lead generation, and customer conversion and retention. More info at localiq.com.
This is WJCT News 89.9 Jacksonville. Up next, national and local news from NPR and the WJCT News team.
In Washington, I'm Corva Coleman. Many in Argentina are remembering Pope Francis, who died today at the age of 88. He was the first ever head of the Catholic Church from Latin America. NPR's Carrie Kahn reports Pope Francis is fondly remembered in his home country as a defender of the poor.
Soldiers do their routine changing of the guard ceremony outside Buenos Aires Metropolitan Cathedral, where then Jorge Mario Bergoglio served as Archbishop. Sandra Rodriguez, 47 years old, says the Pope was a humble man, always with the poor people.
Era muy de barrio, muy humilde.
Her friend, 51-year-old Andrea Godoy, says she's disappointed, though, he never returned to Argentina.
No hay trabajo, no hay igualdad social, ni cerca.
There's no work here now, she says, and inequality is growing, and says he never came back to see our suffering. Before his lengthy hospitalization, Pope Francis had talked of plans to visit Argentina as early as this year. Carrie Kahn, NPR News, Buenos Aires.
Russia's defense ministry says it has resumed military operations in Ukraine following an Easter Day ceasefire. The decision comes after the Kremlin said President Vladimir Putin had not ordered an extension of the unilateral truce, which struggled to hold. NPR's Charles Maines has more from Moscow.
In a statement, Russia's defense ministry acknowledged a lessening of intensity of Ukrainian military activity across the front line Easter Sunday, but still accused Kyiv of carrying out thousands of attacks on Russian-occupied territory in Ukraine. Ukrainian leader Volodymyr Zelensky countered that Russia had created the impression of a ceasefire, but continued artillery and assaults on the front lines. Yet with the formal end of the ceasefire window, Russia immediately resumed airstrikes on its neighbor. The renewal of attacks came despite appeals from the Trump administration to extend the truce, as the White House has expressed growing frustration over lack of progress in U.S.-backed peace talks. Charles Maines, NPR News, Moscow.
This year's Boston Marathon gets underway this hour. It begins with the men's wheelchair division. Thousands of people will participate, but thousands more will line Boston streets to cheer the racers. The event follows the Boston Celtics playoff games and the 250th commemoration over the weekend of the Revolutionary War period battles of Lexington and Concord. In 2013, the Boston Marathon was targeted by bombers. Alan Davis is the FBI Assistant Special Agent in charge in Boston. He says authorities have been on alert all weekend.
The FBI is not aware of any specific or credible threats targeting these events. That said, we are asking everyone to maintain a heightened state of vigilance, given that we are home to many patriotic and symbolic landmarks.
Weather forecasters say today's sunny weather in Boston will be great for racers. Winds will be calm with a high of 61 degrees. This is NPR.
You're listening to WJCT News 89.9 in Jacksonville. Good morning, I'm Stephen Ponson. It's now 9:04. The Jacksonville City Council meets tomorrow and members will vote on two different proposals for acquiring the former Interline Brands building in La Villa. The city wants to take control of it to give it to the University of Florida for its plans to build a graduate campus. News partners at the Jacksonville Daily Record report Mayor Donna Deegan's administration is proposing to trade two properties at Riverfront Plaza with the current owner of the Interline Brands building, Gateway Jacks. Gateway Jacks plans to build a 17-story apartment building along the river. The other option is to pay up to $8 million for the building instead. City Council member Ron Salem is behind that proposal. Tomorrow's council meeting starts at 5 in the evening at City Hall. A traffic signal project continues in Jacksonville's Riverside neighborhood today. The Florida Department of Transportation says drilling will lead to a lane closure and flagging operations at Riverside Avenue and Margaret Street until 9 at night. Drivers should exercise caution in that area. It's going to be a warm afternoon here in Jacksonville and Northeast Florida. Highs this afternoon will reach the upper 80s inland and low to mid 80s along the coast, with partly sunny skies and no rain in the forecast. Overnight, it'll be nice. Lows will drop down into the low to mid 60s inland, and it'll be warmer along the coast with lows in the mid to upper 60s. Tomorrow, partly sunny skies in the afternoon with highs in the upper 80s inland to lower 80s near the coast.
Support for NPR comes from NPR stations. Other contributors include the George Lucas Educational Foundation, creator of Edutopia, dedicated to improving the learning experience for America's students by sharing what works in pre-K through 12 education at edutopia.org.
First Coast Connect. Today, from preventing pandemics to paying for prenatal care to predicting hurricanes, the work of federal agencies touches just about every aspect of our lives. We discuss what it means now that the work of some of those agencies is ending, or in some cases has already ended due to billions in budget cuts. Later in the program, Jacksonville University faculty react to the abrupt firings and what they consider devastating cuts to the school's fine arts programs. But first, the health and safety of Florida residents stands to be impacted by broad cuts to everything from food safety to climate readiness programs. Here to talk about it, I am joined by Dr. Jeffrey Goldhagen, chair of the Department of Pediatrics at the UF College of Medicine, the former director of the local health department. Good morning.
Good morning.
We're also joined by Dr. Mobeen Rathore, associate chair of the University of Florida's Health Jacksonville, also the same school, the College of Medicine. Sorry about that. Dr. Rathore, welcome so much. Glad to have you.
Thank you.
We're also joined via video by Norín Dollard. She's a senior policy analyst and Kids Count director at the Florida Policy Institute. Good morning.
Good morning.
So there are wide-ranging cuts that are being proposed across the spectrum, programs that deal with health and research and well-being. Dr. Goldhagen, what are you most concerned about?
Well, mostly I'm concerned about the assault on science and the assault on institutions. So all of the specific programs that we'll be talking about today are part of institutions and are built on the foundation and framework of science and universities and, frankly, decades of experience and research that have come before. And so what we're seeing is the entire foundation and infrastructure of what we've come to rely on being decimated. And the issue is that we will not be able to put it back together. It's sort of like Humpty Dumpty. And so the longer that this assault and this dismantling of institutions and science continues, the longer and more difficult it will be to actually put it back together again.
Is science unique in that respect? Because we're seeing a lot of agencies that are seeing massive cuts and are being, seeing firings, seeing defundings. Is there anything unique about the world of scientific research or science itself that makes it more difficult to the prospect of rebuilding?
Well, everything that we're looking at, whether it's dismantling the Centers for Disease Control, dismantling NOAA, dismantling the EPA, all of that work is based on years and years of science and research, and those institutions are the strength of those institutions is built on what has come before, and all of those individuals, all of that science, all of that evidence base, all of those institutions are just being dismantled. People are being fired, as you said. They're not coming back to these institutions again. So what we have spent decades and decades building, what has made America great, is now being dismantled in front of our eyes. And again, whether it's predicting hurricanes or addressing the measles outbreak or dealing with housing, whatever issue that you identify, what we've done is dismantled the foundation and infrastructure of those programs and those institutions, and all of that is built over the years in science and research.
So, Dr. Rathore, how about the world of research? I mean, Dr. Goldhagen is talking about that. There are certain data sets that have been removed or become less available. There are studies that are ongoing that are going to take a break of some kind, and information that might have been collected in that period could be lost. Can you explain to people, in the world of research, particularly why that is significant?
So as Jeff mentioned, there are infrastructures that have been built. There are teams that have been built. It's not like in the past. We don't have Alexander Flemings and Jonas Salk, individuals who are doing the research and getting results. Now it's teams. These teams we have taken time to build them, decades. Myself, we have been doing our research here in Jacksonville for more than 30 years, and we have built those teams. And once you start losing the funding, the teams are going to dismantle. And it's not like me as a physician going in and taking care of the patients day one. You have to build these teams. Everybody has a role in that. And what this has done is, for research, for example, if we have had 2 of my 3 NIH grants, we don't have the notice of award. We don't know if they're going to get funded or not. So what does that do? Everybody knows that. So the team people, the staff, the coordinators, the groups, they are concerned. It's also people's livelihoods. They have bills to pay and kids to take care of. So people are leaving. Or, fortunately, I had not had to let go anybody, but people see the writing on the wall and they're leaving. It took us 31 years to build this, and there are people who have been doing this for 40, 50 years. Once you break that, it's extremely difficult to just put it together again. As I said, Humpty Dumpty. Even if you could put Humpty Dumpty together, it's going to take many years.
And you talk about a notice of award. That's something that in the research cycle, you kind of wait to make sure that the money is in place. This has already impacted you in the work that you do?
Absolutely. The funding, way it happens, is all federal funding, not just NIH. You get a notice of award of that funding that goes to the university. The federal government says, hey, we're going to give you this money. And the university says, okay, your credit is good. UNIS advances money and we do our work. Well, if they don't get the notice of award, university doesn't have any money to advance. So I think that's a huge problem. And I think it's going to impact. We talked about CDC. The CDC impact you're going to see sooner, unfortunately. You're already seeing it. 600 cases almost in measles in Texas. And I've got news for you. That's not the worst of it. Think about another Ebola. Think about another COVID-19. You're not going to have time to build that devastated infrastructure. We've already seen it in Florida. The health department has been devastated over decades. It's very difficult to bring it together. CDC is one of the most respected organizations globally. I mean, people are coming from international conferences, and our colleagues world over are very concerned about not only the United States, because many of them are following CDC guidelines.
And so this, you're saying that the impact of CDC cuts is something that we will see and experience faster than we might the cuts to research and agencies like NIH.
Well, the CDC cuts, I hope I'm wrong, but there's going to be just one flight from somebody from some other part of the world bringing in a disease that we have very little knowledge about, where the community of physicians and healthcare workers don't know enough about, and we will not have an organization that's going to guide us to do that. That's what I'm most concerned about. The research part is being devastated, but those results you're going to see 10 years, 5 years down the road. The research is built on small parts which are then brought together, and we have a result. Just remember, for HIV, I've lived HIV care in all my professional life. In 91, we had nothing. In 96, we could treat HIV with a cocktail. And now we're talking about one shot every 6 months, perhaps, for HIV-infected patients. That did not happen by chance or on its own. It took hundreds of people, teams of people working together to be able to build that. These are all interconnected. What the NIH does, what the CDC does, how the FDA gets involved in that. And here's another thing that I'm very concerned about. There is now attack on Ryan White funding. Ryan White funding forms the basis of the infrastructure for healthcare of HIV-infected individuals and families. And the fact that we are in Jacksonville, we have decreased the transmission of HIV infection from mother to babies from 25% to almost zero. That is because of research. We participated with the NIH. That is because the FDA approved the drugs. That is because CDC came up with guidelines, and all of that can now be implemented through Ryan-White funding.
And it's important to also recognize that it's not just infectious diseases. So in the front page of the New York Times this past weekend, there's a major issue with lead in the schools in Milwaukee. And they're looking to the Centers for Disease Control for help, support, how to mitigate, how to intervene, how to prevent. And there's no lead program anymore
and no
at
one
the
to
CDC.
call. I think the guy in the article was saying there's no bat phone. There's nobody to pick up the phone and say, I need help in Milwaukee.
Absolutely. So it's not just infectious diseases, although bird flu is knocking on the door at this point. But it's things as like lead and other critical issues that are impacting communities, and that's our children. It's not when you ask the question, is this in the future? It's today that's happening today.
And to Jeff's point, I think many people, not just those of us in academics, count on that number, which is listed. You can pick that phone, call that number and say, I have this issue. And somebody at CDC will answer that call and get back to you very quickly. In 92, I don't know if Jeff was the director of the health department, when we had the measles outbreak, it was a pediatrician in this community who picked up the phone and called Jeff's department and say, hey, I'm seeing measles. We all got involved. The CDC got involved. And, we had a lot of cases, but we mitigated it in this community because of the efforts of all these different groups.
Yeah, and we know that some of those cuts that are impacting are people that were assigned to work on the measles outbreak in Texas. Those are people that have been scaled back in these cuts. I want to bring in Norín Dollard, though, if I can. The Florida Policy Institute has looked at some of these cuts. What is the agency? I mean, you oversee the Kids Count program there specifically. What are your what's your research showing about what these impacts could be for children in particular?
Yes, thank you. We are very concerned about what is happening at the federal level. There are proposals to that would substantially cut Medicaid and for one, which is publicly funded health insurance and covers nearly 40% of Florida's children. So a substantial proportion. And why health insurance is important is that it confers benefits to kids over their lifetime, and not just the expected health outcomes, but also in terms of their educational outcomes and economic outcomes. So to take away this safety net from them is just insane. To take the safety net away, we have a very high uninsured rate of for children as well. We're ranked at 47th of the 50 states, and it's a huge number of children. Statewide, we're talking about 4.2 million Floridians, including 2.1 million children. So it's really a substantial proportion.
And we should be clear, I mean, the cuts that you're talking about are largely what we're looking at in this 2025 proposed budget that call for $2 trillion in mandatory spending cuts from areas that include Medicare and Medicaid services.
That's right, the Centers for Medicaid and Medicare Services. And there has been a concurrent budget resolution passed about a week or so ago, and the House was instructed to reduce the federal deficit. It's a little confusing. The Senate's language is not the same, so there will be some negotiation about exactly what will transpire. They're preparing for a budget, what they call a budget reconciliation process, which would implement these cuts. And there should be opportunities to expand Medicaid. When you look at polling, Floridians are very invested in having health insurance and actually expanding Medicaid to young adults without health insurance that fall into the gap where they're not covered by what is known as Obamacare, Marketplace, or they they're not eligible for Medicaid because they make just a little too much money, but their employers don't cover. And, that's, more than another million Floridians that expansion would support. And we're one of only 9 states that has not taken advantage of Medicaid expansion. And it's, of course, the health benefits are very important, but there's huge economic benefits as well because of expansion would bring new jobs. There's a huge increase, like $44 billion in economic growth. So in essence, this program really kind of pays for itself if it were to be expanded. So it is a big boon. It would be a boon to our economy.
If you're just joining us, we were talking about the potential impacts of massive cuts to federal health, safety, and research programs. If you have thoughts about the cuts, you can join the conversation at 904-549-2937. You can email firstcoastconnect@wjct.org or reach out on social media. I want to shift gears just to talk a little bit about climate preparedness, because we know that one of the impacts of these proposed cuts is NOAA. These are cuts that are coming less than 2 months before the start of the 2025 hurricane season. These are cuts that are supposed to take place immediately. As much as 27% of NOAA's budget cut immediately. Dr. Goldhagen, what would the concern there be, particularly for Florida?
Well, so the cuts to NOAA and research and so on related to climate change will have a devastating effect, not only in our preparation, but also, and interestingly enough, also on the capacity of our farmers to actually predict what the weather is, to know what the weather is going to be. So on the surface, it looks as if these cuts are primarily going to have an outcome related to our preparedness and ability to respond to hurricanes and other events. But it's also deeper than that. So that whether it's agriculture or issues related to wildfires and other climate-related concerns, we've lost our capacity to monitor them and to respond to them. And we in Florida obviously will be significantly impacted. And it's not just the institutions, but also the science that universities and so on and so forth that are funded to study these issues, climate issues, that are being defunded as well.
And these are all interrelated things. I think that's the thing. One part, Medicaid cuts affects what? You have a hurricane, and then all these children and people who have no insurance, they get injured, they have infections, they have other diseases, they go to the hospital. How are the hospitals going to afford? They'll have to take care of the uninsured. And children's hospitals, I don't speak for children's hospital, but children's hospitals have a very high percent of Medicaid population. And they also take care of everyone. So this is going to have a significant impact on that part of, as I said, all these things are important on their own, but when you talk about interrelatedness of these things, then it's exponential problems.
Dr. Goldhagen mentioned the impact on research, and people maybe don't understand just how much of the nation's research, how much of NIH's research dollars go to schools that do that kind of research and sort of the rationale behind that. Maybe you can explain a little bit about the impact on schools and kind of why it's designed that way.
So I think any funding that we get from NIH, from the federal government, the institutions get a percent what they call the indirect costs, which is started with Dr. Jonas Salk and March of Dimes. He was the first investigator who got indirect costs, and that helped build the infrastructure. And that's very important. Now, I would say that there's perhaps opportunity to look at that part, what percentage should be, all of those things. I'm not an economist, but I think that is something that can be looked at. But what is spent directly on research, so for every $100 I get for research from NIH, University of Florida gets $52. So that helps them to have the IRB, that helps them to have all the other things. That doesn't help it directly, but indirectly helps. So I think you can look at everything. You can look at the efficiency, the cost. I'm okay with that. All of us should be okay with that, that there's no wastage. But to just cut it outright and stop it makes absolutely no sense. It's dangerous. It's dangerous to the population. It's dangerous to you, to me, to Jeff, to Noreen, because we have children, grandchildren, ourselves. You know, what's coming next? I mean, certainly you won't have the resources to take care of even the elderly, because they are going to be impacted.
Don't look at me when you say elderly.
Norín Dollard, in terms of SNAP benefits, that's also something that is at risk. How does that impact the picture for, women who are expecting a child or families with small children?
So the Supplemental Nutrition Assistance Program, or SNAP, what we used to call food stamps, has a huge great benefit on Florida's children and families. I mean, children need proper nutrition for brain development, so they're able to, live really thrive and live up to their potential. And their mothers, of course, need nutrition, during pregnancy. And SNAP actually has been shown to have positive effects on maternal mental health. And Dr. Rathore said all of these things are interrelated. The climate, child nutrition, and their ability to really grow and thrive. Unfortunately, in our state, we have nearly 3 million Floridians who are food insecure. So that's like 1 in 5, and 1 in 5 kids. In Duval County alone, there's more than 125,000 residents who are considered food insecure, including 23% of their children. SNAP is, Dr. Rathore was talking about efficiencies, and SNAP has been shown to be one of the most efficient programs that federal programs, and it's largely funded through the federal government. The state does contribute, and what they call the administrative share. So the food gets to the people who need it, but the federal government is the one who pays for nutritional benefits, the U.S. Department of Agriculture. And that also, relates to Florida's farmers, because not only does SNAP have benefit to the recipients of the nutrition assistance, but those folks spend money in the economy using their assistance, and and so there's farmers who are positively affected because there is nutritional support going to Florida's families. There are huge anti-poverty benefits that are conferred through SNAP. It benefits veterans. 7% of Florida's veterans receive SNAP. So there's many important benefits for Florida. And the thing that the threat, as it is known, and these things do change sometimes minute to minute, but the most recent proposals include introducing a cost share to Florida, meaning that the state's legislature would have to appropriate dollars, so either 5, 10, 25%. All of these numbers have been floated. So we would have to account for that in our state budget. And as you all know, it is the legislative session is going on right now for another few weeks, and I spend a lot of time paying attention to what happens in the legislature, and I've heard no conversation about the state preparing to pick up any shortfalls that could happen from the federal budget process.
Dr. Goldhagen, I mean, there's so many, topics that are interwoven here, but it is hard, I think, for people to get their head around so many disparate issues. I mean, what would you drive home for people who are trying to digest the impact of these cuts and how to think about them?
Well, it's particularly important that people understand that their day-to-day life is going to be affected by these cuts. The main focus now is on the cost of food in our grocery stores and the tariffs. But when we look at the entire community that depends on mental health services, those are being cut. Communities that rely on housing support and affordable housing, those are being cut. The community of people on the autism spectrum have now really revolted by what we heard Kennedy say about autism. Their lives are going to be impacted. What I think reaches a status of diabolical is in our state where child labor laws are being changed to allow 14-year-olds to work overnight to be able to replace the deported migrants. I mean, those issues. So whatever part of your life, every part of all of our lives are going to be impacted. And I would ask people just to pay attention to those impacts that they're experiencing on a daily basis. Medicaid, as an example, less than 50% of the dollars for Medicaid go to cover insurance. The bulk of Medicaid dollars go to cover a nursing home care for low-income people and even high-income people who spend their resources down. So nursing home care is going to be impacted as an example.
Yeah, and we didn't even get to food safety, but we are going to have to leave it there. Dr. Jeffrey Goldhagen, Dr. Mobeen Rathore, and Dr. Norín Dollard, thank you all so much for being here. I really appreciate it.
Thank you.
Thank you.
Thank you.
Up next, Jacksonville University. The Jacksonville University would be eliminating its music and theater programs and laying off nearly 40 professors. Stunned many. For those affected, the announcement and the way the announcement was handled was almost as upsetting as the news itself. Here to talk about it, I am joined by Professor Scott Watkins. He's a professor of piano at Jacksonville University. Good morning, Scott.
Good morning.
Kim Beasley, chair of the Department of Music at Jacksonville University. Good morning, Kim.
Good morning, Ann.
And Dr. Eric Freiberger, chair of the Jacksonville University Philosophy Department. Good morning.
Good morning.
So we should be clear, each of you are appearing here not as a representative of Jacksonville University, but just on your own behalf. Eric, I'd like to start with you. Your department was eliminated altogether. You've been there nearly 3 decades. And
the department was not eliminated. The philosophy major was eliminated.
I'm sorry. Okay.
The minor was preserved, but we had 3 faculty members. They cut 2 of us, and they left 1 in place. But we are also part of the university core. Philosophy is still in the core. We have to run about 20 sections of Introduction to Philosophy or Ethics, which also qualifies for the core, every semester. Now those courses are going to be taught by underpaid adjuncts. And the quality of the teaching, I'm not saying that the adjuncts are doing a bad job, but, you don't have people who've dedicated their lives and careers to that process.
Scott Watkins, the music department or the major also eliminated. You have worked at Jacksonville University since 2001. Can you tell us just how you heard about these cuts?
Monday afternoon in the music building, our emails just started pinging late in the afternoon with invitations to meet with the provost to talk about budgetary alignment. And we had a music faculty meeting earlier in the day, and the news was sort of ominous coming out of that meeting, and we didn't know really what to expect. We knew that the university had some financial challenges ahead of it, and we were hoping to be part of the solution to those challenges. So we just ran out into the hallway and consoled each other the best we could, asking, hey, did you get the email? And that literally is how it happened.
Your wife is the director of orchestra at Jacksonville University. So this is very close to your heart.
Yes, it is. In one quick decision, ruined probably the careers, maybe the lives of an entire household. So we didn't see it coming, as I said, and it's been very hurtful and painful. I personally, my wife, also violinist, we have performed, as has our department chair, Kim Beasley, who's sitting with me. We have performed at President Kost's house numerous times. I helped him.
The Jacksonville University president, Tim Kost.
That's correct, yes. Happy to help him a few years ago, help him and his wife pick out a piano for their home, and shared many good experiences and memories at their home around music and supporting donorship, and it just an incredible sense of betrayal at this point.
Kim, are you also feeling that same sense of betrayal? Is it personal? I mean, does it feel like this was handled in a way that was just brusque beyond what was necessary?
Definitely. And I think the timing is terrible. It's terrible for faculty. It's terrible for students.
Explain why that is. There's certain deadlines.
There's an academic kind of calendar, and for faculty, that's job postings go up in the fall. You put your search committees together. Those searches, take place in the spring to recommend someone for the following fall, if you're filling a position. So faculty, the job market is closed
For next
right
year.
now,
Mhm.
and we will have to wait a whole nother school year to be hopefully placed somewhere in fall of 26. So that's what we're looking at as faculty members. The students, and I'm speaking from a music perspective on this, auditions are done. So, and I have to say that our fellow institutions in Florida and beyond nationally are reaching out with open arms to extend their deadlines for auditions and listen to our students perform so that they can have a place to go.
If you're just joining us, I'm talking to 3 professors who were fired in the recently announced cutbacks at Jacksonville University. If you are a current or former Dolphin, we'd love to hear from you. Give us a call at 904-549-2937 or email firstcoastconnect@wjct.org. We're actually getting a large volume of phone calls. I'd like to start with Tracy in Jacksonville. Good morning, Tracy. Go ahead.
Good morning.
Go ahead, Tracy.
Hi. Yeah, I just wanted to call in. I know this is a really tough situation for everyone, but my son goes to JU. He's a freshman there, and I've been I've known a lot of people that graduated from JU, and I understand that the number of students that are enrolled in these majors is really low. I think it's 100 people from what I've heard and read. Which is a really small portion, and I just know that I know it's tough, but I feel like that the president is doing his best on trying to sustain the university to going forward and cutting programs that the students are really not applying for, and they are trying to grow the areas where it seems like more people are interested in. So those are just my 2 cents.
Tracy, that's their narrative. This is Dr. Freiberger. But I think what you need to understand is they have violated the university bylaws. We were all supposed to have a year announcement, year's time when they announce this, and be paid for another year.
As tenured professors.
That's correct. They are trying to pretend like this is some kind of great service to the university, but it's a lot more than 100 people.
Mm-hmm.
They have cut chemistry. They've cut political science. They've cut philosophy, they've cut economics, they've cut across the board, and most of these departments are left with one person in position that's simply going to be hiring adjuncts. This is a financial disaster that President Kost should have seen coming. We hired him for his business acumen, and he let us down. Okay, they should have done this last summer when they had some inkling that it was happening. The university has been relying on outside funding. This is an absolute abject failure of management, and it needs to be understood as such. They're trying to PR their way out of this and pretend like they're doing some kind of great service, saving the university. That is nonsense.
We've got a call from Kim in Green Cove. Good morning, Kim. Go ahead.
Good morning. Hello, guys. I just want to thank you guys so much for everything you've done for my daughter. I can't even tell you, how much she's grown. I mean, we chose you guys because of the high caliber professors that were available there. And I just want to thank you all for everything you've done. And I'm so sorry that you guys are going through all of this. But I did have a question. I wasn't sure if you knew this or not because everything happened so suddenly, and my daughter's having a hard time getting clarity to better enable her to make a good decision on her life right now. Do you know that if next year the program, like if she waits to get her degree, because that is an option for her, she can either get her fine arts degree, I guess now with some, certain things that she does, but she also has a scholarship because she double majors as an engineer, and she has a minor in mathematics. And in order for her scholarship to continue, she has to be, I guess, a music student still. And if that's the case, is it going to be accredited?
Yeah, that's an interesting question. I mean, the accreditation issue is obviously one of the underpinnings of this discussion we haven't really gotten to yet, but the school did receive a letter about its potentially imperiled accreditation status because of the financial circumstance that it's in. And it has been put on a kind of watch list, some decisions going to be made in December about accreditation, and that all dependent on whether the school can pull itself out of this financial quagmire that it's in.
That's correct. And there's going to be also likely a letter from the American Association of University Professors to the president saying that he's violated any number of professional norms.
There's a couple of levels of accreditation too, and there's the SAC-COC accreditation.
And that's what we're talking about for December?
Then there's that's the current warning that is out. There's also, we've been accredited by the National Association of Schools of Music since 1931. And what they're going to have left of the music program, because the whole department got cut, they're going to teach out, and music will cease to exist completely at JU. So I'm very concerned about the accreditation and the messaging being given to students, Kim. In answer to your question, we have 140 plus music students to deal with this about. And I do have a call into the National Association of Schools of Music on Tuesday. I'll have a little more information then. But we just completed a very successful site visit for our next renewal of accreditation, which is every 10 years, and it is all going to be gone.
So we did reach out to Jacksonville University ahead of this segment to see if they wanted to participate, and they chose not to. They did send a couple of a list of some comments, but I also wanted to hear directly from President Cost. This is a comment that he made to our news partners at News for Jax about the news of the cuts.
The excitement is now you're going to double down and triple down on things that we think this community wants us to do well to help out the economy. Everything to do with healthcare, business, and technology. And on the other hand, we're taking a long, hard look at things that people look to us much less for, which might have to do with the fine arts and the humanities. It's a natural evolution of looking at what you did in the 1960s and 70s versus what you think can help the economy and these students in the 2030s and 2040s.
So Scott Watkins, the president, is framing this as being responsive to changing needs in the community and at the college.
He might be right. But the reality is that he's discarding people in favor of a trade school. And that's, my observation. I think that observation is shared by a lot of my colleagues.
When you say a trade school, explain why you are using that term.
Enter college, get a skill, go out and earn money. I mean, you just heard the president say earning skills for the region, the area. I have nothing against trade schools. That's not what Jacksonville is or was. It's obviously changing. There could have been different ways that this could have been handled. We were willing to work with the administration to provide solutions and to be part of the solution going forward to help through the financial crisis that we did not create, by the way. And no one said anything. The last thing that we heard was a survey put out by the provost's office in November asking us to rank a number of things that, may have been like terminating retirement contributions or, streamlining curricula, that sort of thing. Termination of faculty, eliminating programs was not on that list.
I mean, the president has said that there was this task force that was made up and by members of the faculty that made these recommendations in terms of the cuts.
But they did not follow the bylaws. That's the problem. The bylaws specify they're supposed to work with us, consult us, engage with department heads. That never happened, right? And they're trying to claim that this is a faculty task force that did it, but it was not done appropriately. That's part of the problem. I mean, we're all blameless. We've done our jobs. We've been, exemplary service to the university, in my case for 27 years, in my colleague's case for, almost 2 decades. And it's quite sad that JU can no longer legitimately call itself a liberal arts and sciences institution. I mean, how do you run a liberal arts institution when you've got one faculty member in history, one faculty member in political science, one faculty member in philosophy, and yet you've got a huge chunk of the core? The quality of the teaching is going to go way, way down. And it's very, very sad that this is what this has come to.
I want to take a call from Ari in Jacksonville. We've got just about a minute, Ari, before our break. Go ahead.
Hi, yes, good morning. I've got to say, I've known President Cost and some members of the Board of Trustees for some time, and I just know where their heart is. I also know that he and the Board of Trustees, made this decision factoring in all of the considerations, including, this very difficult impact on the faculty that's been dedicated and has contributed so much to JU. But at the end of the day, what they're trying to do, and I truly believe this, is to make sure JU continues to be relevant as a talent pipeline for the industries that are either calling Jacksonville home or that are planning on calling Jacksonville home. And those are the industries in the fintech and healthcare space. JU's been around for 91 years, and I think this focus is meant to ensure that JU will continue to be around for another 91 years, and will produce the talent that Jacksonville needs to take its rightful place, as a key city on the East Coast.
Thank you, Ari.
Don't you think that turning out critical thinkers, people who can think and write and understand the world, is an essential piece of that? That's what the humanities do. That's what music does. That's what these other programs that are cut are doing. And the problem is, as my esteemed colleague Scott Watkins just said, they're turning this into a trade school. It's vocational training. That is not what universities are for. Universities are designed to turn out well-rounded citizens and critical thinkers.
Is it fair to say, just about 15 seconds, is it fair to say that the way this was handled, though, is more problematic for you than the substance of how the changes are going to be implemented?
Well, I mean, none of us is happy, but yes, it was not handled well. It was not handled according to the bylaws. They violated the bylaws, and they're putting us in a really awkward position where I think many of us are going to have no choice but to respond with legal action.
All right, we're going to take a short break. We'll be back in just 2 minutes.
Life South Community Blood Centers, providing blood and patient services to the local hospitals, serving patients in this community. Donating blood with Life South helps save lives. More at lifesouth.org to find a blood drive near you.
On April 25th and 26th, Shi Yun Sung leads the Jacksonville Symphony in Dvorak's New World Symphony, Copeland's The Tender Land Suite, and more. Visit jacksymphony.org.
On the next Fresh Air, actor Noah Wiley of the popular TV series The Pit about drama and chaos in a Pittsburgh hospital emergency room. The show has earned a following among ER doctors for the accuracy of its portrayals of emergency medicine. Wiley plays a veteran doctor plagued by PTSD from the early days of COVID. Join us.
Today at noon on WJCT News 89.9.
With more than 60% of Americans taking a prescription drug, there are increasing questions about how these medicines are approved and how they're priced.
We are the only country on earth in which a company can say, because I can, and that's the price, and you got nothing to say about it.
I'm Deborah Becker. Harvard's Dr. Jerry Avorn on how to fix what he sees as an ailing U.S. medication market. That's on the next On Point.
Today at 11, here on WJCT News 89.9.
El Salvador is now key to the Trump administration's deportation policy. But what does the country's president, Nayib Bukele, gain from helping the administration carry out its deportations? Bukele won the presidency in 2019, promising to reduce violent crime and the influence of gangs. We'll look at how he's run the country since. That's next time on 1A.
Today, starting at 10 on WJCT News 89.9.
Welcome back. If you're just joining us, we are talking with 3 faculty members impacted by the recent cuts at Jacksonville University. We're continuing our conversation. I want to start, if I can, with a call from Linda in Mandarin. Good morning, Linda. Go ahead.
Good morning. I was just trying to do a timeline because I have people that have graduated from JU. So the last JU was on my track. I heard about a law school and some kerfluffles about maybe a medical school. So, and they may not be able to address this, but I'm trying to, the timeline, when did they go left and become almost insolvent? How did that happen when you're adding, forward-facing programs and then you're going to be cutting the core of what undergirds a university with the humanities and fine arts? I just don't understand how that even happened. Where did the money go for this things and you don't have money for the core of your university program?
Linda, it's a good question. We have a similar one from Ed on Facebook just saying, what is the actual budget deficit that caused this?
Well, there was some outside funding we didn't get from the state in the fall. They've also cut the discount rate. That's the actual the price that students actually pay to enroll in the university in an attempt to get a better quality of student. They were anticipating more funds from the city that didn't arrive in a timely manner for the law school. The medical school is actually going to pay JU some money in future, so we're told, and it's supposedly not going to cost the university anything. However, they've tried to expand too quickly, and they've done it. And the programs that they've tried to expand into have not come to fruition. And as a result, there's just not as much money coming in as there needs to be. We were told by the provost in our last faculty meeting that she attended that there were 50 more faculty than were required to teach the classes. How did that happen? That's not on us. That's on management. That's on the administration. They're the ones who messed this up and miscalculated. We are the ones who are paying the price.
Got a call from Nancy in Arlington. Good morning, Nancy. Go ahead.
Hi. I'm a retired professor at JU of art history and humanities for over 30 years. And we've always been told to tell our students the job you want in your future career doesn't exist yet. So don't train for a specific little cubbyhole because the world's changing too fast. Instead, the liberal arts experience, that really means the liberated mind. Look in and open as many doors as you can and learn how to connect disparate kinds of information and be creative. And what I'm really calling in to tell you is that I have found out over the last 3 years that the library at JU has been decimated. It has been gutted of its liberal arts core of books. About $500,000 worth of books have been taken to the dump to either be buried or burned. These are the core classics and brand new books in the liberal arts section ranging across many disciplines based on a faulty survey the library did of the faculty to see which books supposedly weren't being used. It was an ill-conceived survey, but they proceeded anyway and identified basically 90% of the art history, music, archaeology, and architecture, and I don't know how much in the other disciplines. And
I'm sorry, Nancy, I'm going to put you on hold for a second. Kim, you're nodding your head. Is that something that you're familiar with, that purging of the books? Or
I was contacted as chair of the department. I can't remember exactly when, and it was a few years ago, but about our music holdings. And we have to have holdings in the library for our accreditation with NASM. So that's not an option. So I asked the library to please hold on to our music holdings. They are up on the second floor, mostly still intact because I said, no, don't get rid of them.
Yeah. Just one note from Jackson. He emailed, my wife and I both graduated with music degrees from Jacksonville University and are professional musicians. We were formed as musicians by the professional training ground of the music program and formed as people by its liberal arts curriculum. It is profoundly disappointing and surprising to see this, quote, nail in the coffin for JU's liberal arts identity and music program, especially given the investments made in previous years by generous donors such as Linda Barry Stein. We did mention, the Fine Arts College is named for her. She's made, I think, one of the largest donations in JU history that resulted in that naming. But that school is, as we know it, is going away.
My understanding is that Linda Barry Stein was not consulted about this until it was 8 a.m. on Monday morning that she found out. They didn't consult her about the changes, eliminating a school which I believe in discipline that I believe she majored in when she was at JU.
She did.
It's simply outrageous.
We do know that we asked JU about that, and they said that it is not their policy to consult with donors prior to decisions made at the administrative level about that.
Very convenient, isn't it?
Yeah, but they said that the endowment for the fine arts will continue. We are probably going to have to leave it there. I just ask for your final thoughts for people who are interested in supporting the faculty. I know there's a protest tomorrow on campus that students are proposing.
Yeah, the students have been incredibly supportive. We love them so much. They've been so encouraging. And before we quit, Ann, I just want to touch up on something Dr. Freiberger said, and that was he was mentioning the financial task force. Excuse me. In January, we were promised to be able to see that task force report, and then the president suddenly changed his mind in February. So we never saw that.
Well, I appreciate all of you being here today. Scott Watkins, Kim Beasley, Dr. Eric Freiberger, really appreciate it.
Thank you.
All right. And that's our program. Thank you for listening. If you missed anything, you can catch our rebroadcast at 8 o'clock or find our entire archive on your favorite podcast platform. I'm Ann Schindler. You've been listening to First Coast Connect on WJCT News 89.9.
Support for First Coast Connect is provided by Baptist Health and the North Florida TPO.
Errol Hogan Law.
I'm Wayne Hogan. One texter call can wreck it all. Learn more through distracted driving presentations for teens and the workforce. Arrive alive. Let's end distracted driving.
More at HeraldHoganLaw.com. Baptist Health is a proud supporter of First Coast Connect. Baptist Health, committed to building a healthier community for all of us. More info at 202-4YOU or BaptistJax.com. The North Florida TPO is dedicated to transportation planning, funding, clean fuels, and new technologies for a vibrant, resilient, and connected region. More information available at northfloridatpo.com.
This is WJCT News 89.9 Jacksonville. Up next, national and local news from NPR and the WJCT News team.
The Trump administration has defied the courts